Thank you all for tuning in to the Conversations with NCHPH podcast. Today, we will be talking about flu vaccination. And with me today is Dr. Jose Leon, our Chief Medical Officer for the National Center for Health and Public Housing, followed by Fide Pineda Sandoval, our Training and Technical Assistance Manager for the National Center in Health and Public Housing. I'm going to pass this over to Fide.
Hi, Chantel. Thank you. Thank you so much for that very nice introduction. So before we continue with today's topic, we are going to be discussing, is it too late to get the flu vaccine? So according to the new preliminary in-season burden estimates for the 2023-2024 U.S. flu season, was published by the Center for Disease Control and Prevention. Estimates from October 1st, 2023 through November 25th indicate that the cumulative in-season numbers of flu illnesses are between 1.8 to 3.6 million cases, and flu medical visits range between 810,000 to 1.7 million. Also, there were between 1,700 to 3,600 flu-related hospitalizations and between 1,100 to 3,100 flu deaths. These numbers indicate the need to educate the general population about obtaining the flu vaccine during this year's flu season, including special populations such as residents of public housing that may be at higher risks of developing complications from a flu illness during this season. So to continue with our discussion today, I am going to lead a few questions and I will transfer this to Dr. Jose Leon.
Thank you, Fide. It's a great pleasure for me to be part of this podcast. It's my understanding that this season is going to be mild. However, that doesn't mean that we don't have to get vaccinated. Remember that vaccination is the best tool that we have to avoid complications from the flu. And also keep in mind that flu is not the only virus that is circulating. Right now, as we know, we are just getting out of the COVID-19 pandemic. However, the COVID-19 virus is still circulating. And this is also a season, the RSV season. So all those who are at risk need to get vaccinated against these conditions.
That is correct, Dr. Leon. So for our first question, we have, can I get infected by the flu and COVID-19 at the same time?
That's a good question, Fide. And one of the questions that clinicians get often when they are seeing patients or nurses when they are vaccinating patients. And the answer is yes. Not only you can get the two diseases at the same time, and this is a co-infection, but also you can get the two vaccines at the same time. So your immune system is capable enough to provide the antibodies that we need to fight the infection and at the same time create antibodies against the conditions.
That's great. That's great how science has evolved so much, especially within the last few years on developing a vaccine, that can be utilized for multiple purposes, such as COVID-19, addressing COVID-19 infections and the flu vaccine as well. So for the next question we have, can I get infected by the flu and my apologies. Does the COVID-19 vaccine protect me from getting the flu?
These are two different viruses. So if you receive the influenza vaccine, you are only going to be protected against influenza. Whereas if you have received the COVID-19 recommended doses, then you are going to be protected against COVID. So the recommendation is to receive both vaccines. If you, in case you have not received the COVID-19 vaccine, If you are in the recommended age to receive the RSV vaccine is also recommended. All these vaccines can be given simultaneously. So there is no need to go once or twice or three times to the clinic. You can just get vaccinated on the same day, as long as either you use a different site, or if you are using the same site, there has to be at least an inch between the doses of the vaccines that you are receiving.
Right. So now, this leads me to the next question. Who should and who should not receive the flu vaccine?
That's an excellent question, Fide. There are some misunderstanding about the vaccines in general. And after COVID, we got a lot of negative communication and against vaccines in general. So what we have had is that people have lost confidence in the vaccines, and that's not the case. Throughout the times, we've been able to protect our children against other conditions such as measles or varicella or polio. And there is no reason now to believe that that the vaccine can cause any issue to the person who is getting the vaccine, as long as the person is receiving the age-appropriate vaccine and the recommended dose. So, who should receive the vaccine? CDC is recommending the vaccine for everyone who is 6 months and older. And there are some recommendations for high-risk populations. So for high-risk populations, it's imperative for them to receive the vaccine, those who are over the age of 65, under the age of 5, because they are more likely to have complications, those who are immunocompromised, those who have cancer, diabetes, asthma, or any chronic medical condition. So anyone can receive the vaccine, but these groups are a priority when we are vaccinating our patients.
Right. So in our next question we have, is it too late to get the flu vaccine right now that we're almost at the end of the 2023 year?
That's another excellent question. We have patients who are going to the primary care settings that they usually go to, either the FQACs, the federally qualified health centers, or other clinics, private clinics that they can go to. And they think that it's too late to get vaccinated. But in reality, it's never too late to get the influenza vaccine. And the recommendation is to get the influenza vaccine throughout the winter, as long as the vaccine has not expired. So even though the ideal time to receive the vaccine, according to the latest recommendations from the Centers for Disease Control and Prevention, is to receive the vaccine between October and November, that doesn't mean that if you have not received the vaccine, you cannot receive the vaccine, especially if you are a person who is in any of these high-risk groups. If you are over the age of 65, if you are, or if you have a kid who is younger than 5 years old, or if you have any chronic medical condition, or you have cancer.
Great. That's very valuable information to keep in mind. Can I get the flu vaccine with other vaccines at the same time?
Yes. These vaccines can be received at any time, and there is no interval between the vaccines. These are considered vaccines, inactive vaccines, which means they do not have live viruses. There is only one influenza vaccine that is live, and is the live attenuated influenza vaccine. And that vaccine has specific recommendations. So if you think that you can receive that vaccine, please contact your primary care provider, and he is going to determine whether or not you can get the live attenuated influenza vaccine. However, since these vaccines are inactive or inactivated, they can be administered at any time, and there is no minimum interval between the doses. Ideally, you can receive the vaccines on the same day. In other words, if you are a patient who is over the age of 65, you can easily get the RSV vaccine. You can get the COVID-19 vaccine if you have not received the COVID-19 vaccine, and the influenza vaccine. And even for children who are going to be vaccinated for the first time, or they are trying to complete their standard series, and they are over the age of 6 months, in addition to all the vaccines recommended by CDC for their age, they can also get the influenza vaccine.
Mhm. Right. There was one very important topic that I think it was very useful, that you mentioned also, was about the live viruses, how to keep in mind that information whenever you go and speak to your provider.
It's important because there are some contraindications to receive the live vaccine. If you are immunocompromised, the vaccine cannot be given to you because you can get sick if you get the vaccine. And just let me be clear. I'm talking about the live attenuated influenza vaccine. You cannot get sick if you receive the inactivated vaccine or any of the inactivated vaccines that we have for this influenza season. So there are other vaccines that children usually get, and these vaccines are live also, the measles vaccine and the varicella vaccines. Those are live vaccines, and just we need to keep in mind that we talk to our provider when either our kids or seniors are getting vaccinated, and making sure that they receive the vaccines that they need for their age.
Yeah. So for a final question, let's say that I do not have a care provider. Where could I go get the flu vaccine?
That's also a great question, Fide. In reality, you can get the vaccine at pharmacies in general, but we work very closely with federally qualified health centers, and all health centers have the influenza vaccine and the other vaccines available. If you don't have a provider and you would like to receive the vaccine, or you are not insured at this moment, or you don't know whether or not you will be able to pay or co-pay for the vaccine, please go to any of the federally qualified health centers. And if you go to the website www.hrsa.gov, you can find a locator. They have an app where you can locate the your closest clinic, health center clinic, and those are the best places where you can get the vaccine.
Great. Well, that is the end for all of the questions that we received via email from the people who were interested in learning more about today's topic. Dr. Leon, do you have any final remarks, any final advice for anybody who would be listening to our podcast?
Influenza is a serious disease. Sometimes we believe that we're going to get sick, and 3 or 4 or 5 days later, we're going to be okay. However, sometimes that's not the case. So if you know, or if you are one who is in any of these high-risk populations, please make sure that you receive the vaccine. And remember that people can have serious complications if they don't get vaccinated. So the latest data from CDC is that as of today, or as of last week, there have been 5 deaths, and these are for children under the age of 5. So please keep that in mind and make sure that all the people that you love and that are around you are getting vaccinated.
Thank you so much, Dr. Leon. That was some very great information that we received today.
All right, and I would like to thank everyone for listening to this podcast today. If you were interested in learning more about the National Center for Health and Public Housing, please visit our website at www.nchph.org.
Thank you. Thank you so much. And happy holidays.
Happy holidays, everyone. Thank you.